All right, thank you so much for staying with Daybreak. So the World Health Organization has welcomed the initial trial results of a drug that could be used to treat COVID-19. Researchers in the UK found that the anti-inflammatory drug known as dexamethasone significantly increased the patient's chances of surviving a COVID-19 infection. The drug that is commonly used for diseases such as arthritis has raised hopes of managing the global pandemic. Joining me now is Dr. Moses Masika. He's a virologist. Dr. Moses, thanks for making time for us. Is this the silver bullet we've all been waiting for?
Good morning, Trevor. I'm pleased to join you. This is not the silver bullet. I wouldn't call it that. Maybe a rubber bullet, because it will disorient but not kill the pandemic as such. I say that because if you look at the numbers, the scientists in the UK were able to save, say, out of 20 people in ICU who would have died, who are in ICU, and if 8 would have died without the drug, 6 will die. So they managed to save 2 in 20, which is not, as you say, the silver bullet, but it shouldn't be ignored. It's a good indicator, and it could be added to some of the tricks we have so far in fighting the virus. And in the country, we then need to verify if the drug would have similar benefits here before we can say for sure it will be any useful.
Is there a possibility that the drug might act differently with the population here compared to the one in the UK?
Well, because the drug is not being used in isolation, there are other factors that are, these patients are also in ICU, they're severely sick, they're being supported by many other services and personnel, so the situations are different. We hope that the effect would be similar, but there is always a chance that there could be something different.
So this is a drug that is used to treat arthritis, really, primarily. How would it react with other patients who don't suffer from arthritis, for example? What are the possible side effects?
Well, steroids are actually used to treat many things besides arthritis, and they also have numerous side effects affecting nearly every system in the body, ranging from blood pressure to mental side effects. But these are often seen when the drugs are used for a bit of a long time, for weeks at least. And when the benefit is clear, healthcare workers are trained to balance the risk with the side effects with the benefit for the betterment of the patient. So it's not something that can be dealt with. What we need to show is whether the drug actually has a benefit in these patients.
So essentially, this is a steroid. So there's water retention in the body, and people tend to have a bit of more side effects. Should we even be considering it as a country then? Yes,
we should not brush it off. We should consider it because we know the virus at that stage, in patients who have severe disease, the immune system is quite overzealous. It's the one that is causing most of the symptoms at that stage. And because steroids like this one tends to dull the immune response, theoretically, it makes sense how it would work. But we know that what is on paper needs to be confirmed clinically.
All right.
So it would be useful.
Yeah, Dr. Masika, I know you've been doing a bit of research on this virus. Are we learning anything new, finally, from me?
Every day, as you can see, dexamethasone is a new story, although the drug is not new. So yes, there's a lot we don't know about this virus. If tomorrow we come back and tell you dexamethasone is a flop, don't kill us. We are learning new things every day, and that is the nature of a new virus.
All right. And for the symptomatic patients, do we know now that they still shed off the virus?
Shedding has been very variable, so we cannot give a definite description of who sheds and for how long. But I think this is normal because different people will handle, the immune system of different people will handle the virus differently. So yes, shedding occurs for variable periods of time from different routes. It's just not clear completely, but we are getting more and more information from across the world.
All right, Dr. Moses Masika, thank you so much for making time for us this morning. We're speaking to Dr. Moses Masika. He's a virologist, talking about the new drug, dexamethasone, trying to find out if this is the silver bullet. He says it's a rubber bullet. It's not the silver bullet per se, but it should not be ignored.